Hi friends, this is Dr. Kashish Grover, your PSM faculty. Guys, today I'm going to talk about a sudden outbreak in the country. A sudden outbreak which is affecting children less than 15 years, a sudden outbreak which is presenting with acute encephalitis syndrome. Yes, I am talking about Chandipura virus outbreak in some part of Gujarat. According to the ministry, according to the Gujarat ministry, there are 16 deaths. There are 16 deaths till date and many children they are affected. Without wasting time, let us discuss about the transmission, the prevention, the treatment, and more importantly, the important aspect for our PG entrance exam. And if I tell you this Chandipura virus was once in INICET, in recent INICET question, it was one of the option in one question from recent INICET. Let us discuss the possible points for our NEET PG exam. Guys, if I talk about the history, the first case of Chandipura virus was seen in 1965 in Nagpur of Maharashtra. From a village, Chandipura, the first case was reported. After that case, the virus is named after that case only. Right? So this is the history about Chandipura virus. It was first isolated in 1965 from the Chandipura village in Nagpur, Maharashtra. Now, if I talk about the key points, it affects children less than 15 years. It behaves like acute encephalitis syndrome. If I ask you a disease which is affecting children less than 15 years and which is presenting like acute encephalitis syndrome, yes, the differential is JE. Japanese encephalitis also presents like acute encephalitis syndrome, affects less than 15 years of age, and it is a potential outbreak. We have seen many outbreaks in the past. Now guys, if I talk about the transmission, Chandipura virus, this disease is a vector-borne disease. What is the vector here? The vector here is a sandfly. And guys, I want to tell you that recently 2 to 3 years back there was one question in INICET, and I am sharing screenshot from DAMS-eMedicoz PYQ. DAMS-eMedicoz PYQ. This is the slide which I discussed in one of the PYT discussion of INICET. So the question was, which of the following is caused by the vector? So this vector is a sandfly, and they are asking you which diseases are caused. Kala Azar, yes. Chandipura encephalitis, yes. And oriental sore, yes. So 1, 3, 5. Right, so this slide I have taken from the INICET PYQ discussion. Now guys, if I talk about the clinical features, are fever, diarrhea, vomiting, and then it progressed to the encephalitis. The symptoms will be like convulsions, altered sensorium, photophobia, and if meningeal irritation is there, then neck stiffness, headache. All of these are the clinical features. Now, if I talk about the treatment, guys, there is no antiviral here. There is no antiviral, there is no immunoglobulin, there is no vaccine. The only thing which we can do is symptomatic management. And the key here is early diagnosis and the treatment. As early as possible, if we diagnose the disease, we can better provide the symptomatic treatment. We can prevent the secondary bacterial infections. We can maintain the fluid electrolyte. Right? So there is no specific treatment. The only thing which is beneficial here is timely diagnosis and referral, and so that the case can be managed symptomatically. Guys, if I talk about prevention, so as you know, this is a sandfly. The vector here is sandfly. So the best prevention here is, as I told you, there is no vaccine available, there is no treatment available, there is no particular immunoglobulin available, right? There is no antiviral available. The only best prevention here is vector control. How we can control the vector? By using synthetic pyrethroids or DDT spray. Is the best for sandfly control. And I want to tell you that sandfly, the habitat for sandfly is the crack in the walls, the storerooms. Right, these are the habitat for sandfly. If we repair cracks in the houses, if we maintain proper sanitation, so this way we can prevent the vector. If vector is prevented, a major portion of disease we will be able to control. Guys, also here I want to tell you few important points about sandfly. Sandfly, it has long legs, it is particular. I want to tell you a few points about sandfly. Sandfly is a habitual nocturnal bite. Habitual nocturnal bite is seen in sandfly, and habitual nocturnal bite, and usually the bite is on lower limb, because it cannot fly very high. Sandfly cannot fly very high. Lower limb bite is common, nocturnal bite is common, and once it bites, the sandfly bite is a painful bite. Right now, guys, this was about vector control, but we need personal protection as well. Full sleeve clothes, full pants, right? We should advise full pants for the children in this region. Now, if I talk about the conclusion, so this is all the important points about the new disease, which many students were asking me to give information about, and I say yes, this is important because this is the recent update, and once in INICET they have asked the question which we have already discussed. So guys, let me conclude. Yes, it is a vector-borne disease. The vector is a sandfly. It behaves like acute encephalitis syndrome. There is no specific treatment, there is no vaccine, and no specific antiviral. Only and only vector control and personal protection is the thing which can be done here. Thank you so much.